membership plan. Even if you haven't yet considered the idea for your practice, you probably know the concept is all the rage in dentistry these days. Insurance isn't an option for all of your patients, but it is an ever-present headache for practices everywhere. That's why more and more dentists are offering this alternative payment strategy. Membership plans typically allow patients to pay a fixed, reduced rate for preventative care on an annual basis. These plans also usually include reduced fees for restorative procedures. Sounds simple and sensible, so why aren't you offering a plan of your own? Maybe because when it comes to creating it, it feels complicated. How would I create my plan? What would we charge? How would I market or sell it to patients? And once established, how would we manage it? Let me cut through all of this by assuring you, you already have the tools in your practice to manage your own plan. You have administrative personnel and software. In this unit, I'll share the exact plan I established and oversee for a practice in Kansas City. It's already working for the practice and patients because it covers the cost of a year's worth of preventive appointments in one easy payment. It keeps patients without insurance tied to your practice because they feel they've made a financial commitment to show up. These are patients who generally value their oral health and are more apt to accept restorative treatment when diagnosed. For these patients, you don't have to worry about PPO reimbursements. They know they won't have to worry about billing statements or headaches at the front desk. They can receive their preventive treatment and walk right out the door. There is a lot to be said for all of this predictability. So let's get to it, keeping in mind one indisputable truth about in-house membership plans. Simplicity is key. I know from experience, keeping it simple will ease the process of building and managing it. And the easier your plan is for patients to understand, the more success you'll have at selling it. Your membership plan should address 3 categories of patients: healthy adults, adults in perio treatment or a history of perio, and children. Some plans out there add a pricing category for additional family members. The problem with that strategy is that you're already making dentistry extremely affordable for members. By giving additional price breaks to additional family members, you're not only complicating your system, you're hovering closer to negative profitability. Stick to these 3 categories and keep it simple. Now, let's begin building yours, beginning with the contract or patient agreement, which is what I like to call it. For a healthy adult, your membership plan will offer a fixed price for a year of the following preventive basics: 2 cleanings, 2 exams, 1 set of x-rays, and 1 emergency appointment if needed. Typical membership pricing for healthy adults is about $279 to $350 per year. Let's look at the exact plan that I created for the practice in Kansas City. For a healthy adult, we charge a $299 annual fee for our plan, which we call the Membership Savings Club. I arrived at this number by looking at the full fees for our preventive basics. Those add up to $550. Our $299 membership is only 54% of our full fees, but there are a few reasons why we settled here. First, we are keeping these uninsured patients tied to the practice and increasing the chances we'll see them for their restorative needs. That's worth a lot. Second, while insurance adjustments may be 20 to 30%, the difference is well worth the time and hassle we avoid by not having to spend time with PPO representatives submitting claims and chasing down reimbursements. Third, patients who may be skeptical of a quote-unquote plan will be easier to entice when they realize they are saving almost 50%. In addition, we offer a 15% discount across the board for all restorative services, Invisalign, etc. Again, we do this to keep everything simple and clear for patients. Some plans will offer 20 to 25% discounts on restorative procedures or different discounts for Invisalign treatment. I don't think that's necessary. At this point, you are getting near what you are writing off for insurance, and you're already giving a large discount for the preventive basics. You'll notice we made that very clear on our brochure. Make sure patients see how much they're saving. Let's move on to adult perio patients. The numbers look a little different here because their visits are more frequent. Our plan covers 3 to 4 perio maintenance visits a year, 2 exams, the x-rays, and an emergency visit. Most practice memberships will charge between $379 to $500 annually for this tier of service. Based on our fees, we set ours at $479, a little above 50% of our regular preventive fees, and a visible, appreciable savings for club members. Restorative and other treatments are again discounted at 15% off across the board. Finally, for children, we offer the same preventive basics as healthy adults: 2 cleanings, 2 exams, x-rays, and 1 emergency. These plans typically range from $249 to $279, and that's exactly what we charge, keeping the membership price in that 50 to 55% range of our full fees. And again, a 15% discount off of restorative and everything else. So those are the plans by the numbers. We've included downloadable copies of each of the 3 versions of our Membership Savings Club. The last part of building your plan is to detail the terms and conditions of the policy, which we've also provided for you below this video. You can review those when defining your own, but the key points here, you'll want to briefly explain the program and the advantages of it. It's very important to note that your club is not insurance and can't be used in conjunction with insurance or any other financing option. In our terms, we also detail the length of the contract, that it's subject to change and not transferable. Finally, a signature line and a payment method. In our advisory calls, we can discuss the pricing specifics of your program. But as you begin thinking about it, remember, simplicity is the key. When you keep the numbers clear, consistent, and the terms uncomplicated, your own membership plan is attainable. I assure you, you got this. In the next video, we'll show you who you should be targeting with your new plan and how to get them to say yes.